Factors modifying drug dosage. So this is a part which comes under pharmacodynamics. There are certain factors which modify the drug dosage. We can't say that same dosage of drug can be given to all the population. Certain factors, certain things are needed for changing or modifying the drug dosage. So what are the factors which needs dosage modification, which produces different drug actions? So those are the factors we are going to discuss in this PowerPoint. So variation in response to the same dose of a drug between different patients and even in the same patient on different occasions will occur. So we can't say the same dose of a drug produces same effect in all the population. So it may produce a different effect in another person. And another thing, more than that, even the same dose of a drug, we can't say that it produces same effect 3 months back as well as now. So the same effect we can't expect what the effect we got 3 months back. The same effect we can't expect now. So even in the same person, it may produces a different action in different occasions. So the range of variability may be marked or limited depending upon the pharmacokinetic and dynamic characteristics of the drug. So the variations of the drug dosage, why it occurs means mainly because of the pharmacokinetic properties as well as pharmacodynamic properties of the drug. Other than that, certain factors are there, depends upon the patient which needs dosage modification. So other than drug means pharmacokinetic and pharmacodynamic properties of the drug, and depends upon the patient, certain factors are there which needs dosage modification. That factors can be broadly classified as physiological factors, pathological factors, genetic factors, environmental factors, and interaction with other drugs. So we can easily say what are the physiological, pathological, genetic, environmental factors. Interaction with other drugs means we can't say a person can take only one drug at a time. So the person may take more than one drug, more than 2 drugs at the time. So the interaction with other drugs also need dosage modification when it start producing adverse effects. So about these are the factors we are going to see under the factors which modify or which needs dosage modification. The first one in that is age. We can't give the same dosage for a child as well as for the adult. Dosage modification is very important and much needed for children. So the adult dose is considered for the patient who is between 18 and 60 years old. So for children under 12 years, the dosage calculation is done using this formula. Young's formula as well as Dilling's formula are the most commonly used formula. Child dose is equal to age by age plus 12 into adult dose. So using this formula, the dosage is calculated for the children. Why dosage modification is needed in children? The main thing is the drug metabolizing enzymes are insufficient in the children. In children as well as in infants, the metabolizing enzymes won't develop properly, so that the metabolism of the drug won't take place. If the metabolism doesn't take place properly means it will naturally affect the excretion process also. If the excretion doesn't done properly means accumulation of the drug inside the body will take place and it will start producing unwanted effects. So drug metabolizing enzymes are not fully developed. And the second thing is barriers. Blood-brain barrier, placental barrier and other blood-testis barrier. These barriers are not developed properly. So mainly because of that, CNS will be sensitive to the drugs. The third one is infants have immature renal tubular transport system. So drug has to be excreted using glomerular filtration, tubular secretion and tubular reabsorption. But if it doesn't develop properly means the excretion of the drugs will get affected. These are the examples why we need dosage modification for children. Other than that, in children, certain drugs are not given for children. Certain drugs are contraindicated in children. For example, tetracycline. because tetracycline produces permanent teeth discoloration, yellow discoloration in the teeth. Like that, if steroids are given for children, it will affect the growth of the children and produce retardation. But these drugs are not contraindicated in adult because in developing the tooth or in the growth, it won't have any effect. So, according to the age, dosage modification has to be